Hi, my name's Joanne Caffrey. I own the training company Total Train, and I'm an expert witness in relation to the use of force, the management of challenging behaviour and safer custody in police and prison establishments. This short presentation is concerning understanding bone density, gender and age when dealing with physical interventions and the assessment of risk and need. This is concerning person-centred care and behaviour plans, safeguarding both children and adults in education, care, custody and clinical settings. If you wish to make contact with me after the presentation, there's a variety of options for getting in touch. You can email me direct at joanne_caffrey@sky.com, or you can contact me via my mobile, or you can email me at my training company, which is totaltrain@sky.com, or connect with me on LinkedIn at Joanne Caffrey, or find me on Facebook, either Joanne Caffrey Expert Witness or Total Train Penrith. So what's this presentation about? Well, we've got 4 basic objectives. Just to look at the risks posed to staff and service users due to their demographics. Secondly, how managing down challenging behaviour plans can address this. Thirdly, adapted restraint positions and or personal protective equipment. And fourthly, first aid responses. So here's a scenario to present to you. We've got a female member of staff who's 50-year-old, asked to complete a physical intervention on a male service user who's 15-year-old. So if we just look at the issues concerning their bone and muscle densities, we're looking here at the female member of staff. She now has diminished bone and muscle strength, and therefore the performance of her bone and muscle has significantly reduced. The 15-year-old, he's actually at his peak bone and muscle strength, and therefore the performance of those bones and muscle strengths. This is where off-the-shelf training can often be detrimental to either service users or the actual staff who are being asked to conduct these interventions. If we look at skeletal bone fractures, so the bone fracture occurs when the bones are subjected to a mechanical load which exceeds their strength. Diminished skeletal strength is a primary risk factor, and gender differences in skeletal structure and strength play a powerful role in determining gender differences in fracture risk. So skeletal muscle, the muscle is one of the most powerful determinants of bone strength, and gender differences in bone-muscle relationship are of key interest in understanding gender differences in bone growth, in age-related bone loss, and in the risk of fracture. If we look at the gender variant patterns, these emerge during adolescence, reflecting the different musculoskeletal effects of testosterone and estrogen in males and females. In males, the changes of bone and muscle during puberty are dominated by the increasing levels of testosterone and IGF-1, which result in increased muscle mass and strength. In women, age-related bone loss begins in the early to mid-30s typically. This process is greatly accentuated by the rapid decrease of estrogen levels occurring as a result of the menopause. Overall, the relationship of muscle mass to bone structure and strength is more preserved in men than in women. So some factors to consider here in relation to both your staff and the service users. Issues here are the gender of the people, the age of the people, body or frame size, the genetics and their ethnicity. And these factors can be modified or affected with things such as hormonal status, lifestyle factors, physical activity levels, smoking and alcohol consumption, and diet or nutrition. So looking at some of the situations, let's imagine we've got a male member of staff who's in his 20s. He works in a clinical setting or care setting, and he's performing a physical intervention on a service user who's an elderly lady in her 70s or 80s. Because of his muscle and bone strength, he's going to be the dominant person, and therefore the risk of fractures is increased significantly for the service user because of her age and her gender. If we look at an education setting, and let's talk about a primary school, then we've got a primary school child who's been restrained, for example, by a male member of staff in his 20s or 30s. Again, the dominant person here is the male member of staff, and therefore the risk of injury is increased to the child. First aid and medical response wise, First aiders and staff should be aware of the gender and age demographics for likelihood of fractures. See also our YouTube video concerning the management of head and brain injuries. And gender and age should be taken into consideration concerning the methodology for dealing with challenging behaviour, and, if it must be used, the type of intervention to be used, taking into consideration the demographics of both the staff and the service user. Safe systems of work adapted to eliminate the risk of injury to either party. A one-size-fits-all is not a safe system of work, as we need to consider both the member of staff and the service user. How can my company help you in your workplace? Well, we can help in a variety of ways. First off, it's about the person-centred assessment of risk. We can look at the risk in relation to the staff who are going to be applying these physical intervention techniques, and also then the service user that they're going to be applied to. We can also look at the therapeutic and sensory integration assessments and plans to manage down the challenging behaviour incidents in the first place, so then hopefully the use of physical intervention is significantly reduced. Also then the behaviour assessments and plans, we can then tailor the training and the plans and the techniques based on the person-centred assessment of risk and need. And if there's any sensory integration issues identified, we can then deliver the training in relation to this to your staff and make it person-centred. And then we can also assist with the ongoing therapeutic and behaviour work. We like to balance the legal, therapeutic and medical models for safe and effective care and behaviour management. And ultimately, Total Train, it's all about safeguarding vulnerable people in education, care, clinical and custody settings. And if you'd like to discuss this further, then there's our details on the screen now. Please drop us an email, give us a call, or contact us via LinkedIn or Facebook. Thank you very much.